Hello and welcome to Chocolate for Dogs, a weekly healthy snack for the brain. I realised last week that I didn't actually introduce anybody. So my name's Tegan. I am an emergency veterinarian in Brisbane. I have been graduated since 2016. I went straight into emergency work. I'm pretty much a freshly jellied kid still in the industry. This is Elodie.
Hi, I'm a veterinary nurse and I've been in the industry for about 6 years. I started off in a busy small animal practice up in Cairns and made the big move to Brisbane and am now in the emergency and critical care world. Yeah.
I'm Brandon. I came here because they told me there was going to be chocolate.
Disappointed!
Today's episode we're going to be talking about toad toxicity and some of the common misconceptions around what to do at home with toad toxicity. What would you do if Murphy got into a toad?
Every time I think about a dog licking a toad, I think of that Family Guy episode where they're getting on drugs by licking toads. So
If you use toad, then I'm telling you, you can kiss your life goodbye.
First an Oreo ad, now Family Guy.
Yeah,
there's a pop culture reference for everything, I think.
Yeah,
true that. Yeah, okay.
So what would you do if Murphy licked a toad though?
Probably take him home and see how we went.
What would you do at home? Would you do anything?
Nah, just give him a bit of water.
So what you should do is get a bowl of water and have a cloth and then basically moisten the cloth and wipe the mouth out for about 15 to 20 minutes before coming down to the vet clinic or on the way to the vet clinic. Don't ever put a hose down the mouth because this can lead to complications like aspiration pneumonia. The most common things that we find with toads is that they lick the toad. It tends to be more dogs like Murphy that get affected the most. So the smaller the dog, the more of a toxic dose that they tend to get. So we find that those are the cases that start to show signs of hypersalivation. They might have a vomit and then they start getting disorientated and start developing neurological signs, always to the point or sometimes to the point of complete seizures. And that's when you need to definitely bring them down to your veterinarian. Do you know they're called seizures?
How it causes seizures. I assume it's to do with the toxins that secrete from their back.
Oh yeah.
But
Not cows.
Yeah, just
Tell me, Dr. Brendan, how is it called seizures?
where are my glasses?
So that's the main thing. Then once they get to the clinic, we basically put in an IV catheter on presentation, depending on how severe they are, and give them some anti-seizure medication if they need it.
And we'll also continue doing a buccal lavage, making sure that the mouth has been well cleaned. We'll usually do it for an additional 10 minutes.
Oh, a common thing we find is like the really red gums, and then we keep wiping until that redness is gone.
And they're quite slimy as well when you feel them. It's usually an indication.
Is that like something that people should be looking out for after their toad?
After their
pet
toad
toad has licked a dog?
What an idiot.
After their pet has licked a toad, would you be looking for inflamed red gums?
Well, it's kind of just
sticky mouth, or would you just take it straight
So
to the
say
vet?
if like your dog went outside and then it came in, looked really disorientated and you didn't really know what was going on. If you lift up that gum and you find that it's really
lift
red,
up the lip.
Sorry, lift up that gum, the lip, then you're going to know that if it's
Some loose
brick
gums.
red, if it's really, really red or brick red, then it tends to be an indication that they've had some kind of access to a toad. And then basically from there we try and stabilise them depending on the severity. Sometimes we just need to keep washing the mouth out and then they go home and they tend to do fine. Usually we have the seizure within, let's say they lick the toad, within 15 minutes they tend to have seizure activity. So it doesn't
Pretty
That
quick
quick.
and rapid
It's very
absorption.
quick. That
Yeah,
quick.
because
It's
it's through
very-
the mucous membranes.
Yeah, so it gets
Awesome.
absorbed all through the gums. Sometimes in
It
the
absorbs
eyes.
straight through the palate into the brain as well.
It just basically goes straight from the gums into the vasculature and then gets circulated
Oh,
in the
good.
vasculature.
So, what part of the body would it affect?
It is neurological. So yeah,
straight to the brain.
it sometimes looks like they're having hallucinations. Sometimes and
They can appear to be stoned. Yeah.
And then it definitely causes effect on the GI signs too. So vomiting, they can have diarrhea a couple of days later as well.
And cardiac as well.
Oh, and cardiac definitely.
So, toads aren't a cool drug that the dogs are
No, toads are not a cool drug that kids are doing. They're often
Dogs.
Dogs.
Xylitol's the cool sugar.
Cool sugar, cool drugs.
Yeah,
not
but the
toads.
kids do all these days.
We actually had a really bad one the other day. I've never actually seen a German Shepherd have a really severe reaction. Usually they just have a vomit and you wipe their mouth out, and German Shepherds are fine. They're pretty resilient. But this one went for the toad 4 times because he thought it was a game, and He came in
often
they often think it's a game, and they think that they're just jumping away for fun. And he came in fully having seizures, and I had him, so he was quite a severe case. They had him getting anti-seizure medication, but then we actually had to induce him into a induced coma and keep him under an induced coma until those seizures and tremors stopped. Usually it takes anywhere between maybe 1 to 2, maybe 3 hours, and then we can get them weaned off of that CRI and then wake them up, and then they tend to wake up really well. But it takes time. But they can be in hospital if they haven't got complications. Usually it's an overnight stay. If there's complications, like they can vomit when having a seizure, so they can actually get aspiration pneumonia, which can be difficult to treat as well.
So aspiration pneumonia is when they've sucked the secretions into their lungs, and it's an infection
Of the lungs.
Yeah.
What happens if I come home from a hard day's work, some hard working classes?
Good joke.
So what happens if I come home and I see half of an eaten toad?
He needs to come in regardless, so you'd need to perform the buccal lavage, so wiping out the mouth, and also he'd need to come in and we'd have to induce emesis, so make him vomit, because even if they've eaten the toad, they can still have the effects.
So the actual toxin itself is secreted on their shoulder glands. So they've got, I think it's called parotid glands, and they actually secrete it from their shoulders.
Is some of the toxin already on the back? So if they lick the toad,
It's
it's
usually
guaranteed that they've got some of it, or
When they're threatened.
I know when they're threatened they secrete more of it, but
I don't actually
is
know
there,
if it
is
just
there like
has
a thin coating of it
I'm not
to
too
start
sure.
with?
Usually the other thing that, potentially, because when they actually sit and soak in water bowls, they can actually have some effects from being in water bowls.
So water bowls are, you got to look out for that too.
Unfortunately, it would be ideal where if your dog is an outside dog, make sure there's no water bowls. Obviously, they need water. Make sure they're elevated. Try and keep them indoors when it's raining, because that's when the toads are going to be most prominent. Trying to do more proactive and preventative measures as well. So make sure Murphy's not outside when we've got a storm coming and things like that.
And people often ask, how do I stop my dog from getting toads? But dogs are naturally inquisitive and will want to chase something that hops away from them. So you can teach the dogs commands such as leave or away, and kind of create not necessarily a negative association with toads, but try and teach them, self-control. Just don't touch. You'll find it's often hunting breeds that will go for toads. So Jack Russells and Dachshunds are usually the most common breeds.
Jack Russells are a hunting breed?
Yeah.
But they're so little.
I know.
They're so little.
It's so cute. But they're the most common breeds that come in.
Yeah, them and lots of Dachshunds.
Dachshunds are a hunting breed?
Yeah.
But they have the tiny legs.
I know, it's ridiculous.
Imagine them chasing a rabbit.
And it usually is actually the small dogs that are more affected. So it's not common that you'll get a Labrador or a German Shepherd that comes in having full-blown seizures. They tend to be the ones that have a vomit, look a little bit stoned, and then get better.
Yeah.
But it's the small ones that get really, really bad. And I guess the main thing from there is when they do present to the veterinary clinic, for us, is emergency stabilisation, depending on how severe it is. So if the dog is stable and presentation doesn't require an IV catheter, then we won't place one and we'll just keep washing out the mouth. But if it comes in having full neurological episodes, then we put in an IV catheter, we give anti-seizure medications, and in some cases we have to induce a coma and keep them in that induced coma until the toxin is completely washed out of the system, which can take hours. So
to wrap it up, so if you see your dog lick a toad, start with the intervention that we spoke about just earlier, so the buccal lavage. Contact your regular vet, make a plan from there. If your dog has deteriorated, then it's probably going to be a good thing if you take your dog to the vet. And Tegan has outlined the treatment. So essentially, the buccal lavage, the potentially going home or staying in for IV fluid therapy, anti-seizure medication, and supportive care.
So that is toad toxicity. Thank you for listening for the day. Next week we will be doing another toxicity or something. We're still deciding.
What should we do next?
Well, actually, fun. You tell us what you would like us to talk about next week, and we can discuss what you'd like us to talk about. Keep in mind that Elodie and I have both emergency practices as well, so we tend to deal less with general practice and deal more with emergency medicine and surgery kind of things.
Emergency and critical care.
Yeah, but we'll give anything a go. So give us a message of what you'd like us to talk about. Message us Q&As as well, and we'll be able to do some questions and answers next week for you. Thank you. Bye.
Thanks.
Bye guys.